Welcome everyone, and thank you for joining me today. Today's presentation is titled Definitions, Guidelines, and Coding Examples. We'll be exploring the key concepts behind ICD-10 PCS, focusing on its 31 root operations. Over the next few slides, I'll walk you through the essential guidelines, share some practical coding examples, and help you better understand how to apply these in real-world scenarios. Let's get started and make this both informative and engaging. Let's take a closer look at this slide. First off, the image you see is credited to an unknown author and is licensed under CC BY-SA/NC, which means it's free to use with some attribution and share-alike restrictions. Now, moving on to the core concept here, we're talking about a specific type of procedure called an alteration. So, what exactly is an alteration? It's when we modify a body part without changing its function. Think of cosmetic procedures, like a rhinoplasty, where the goal is to reshape or enhance appearance rather than fixing a functional problem. For example, cosmetic rhinoplasty is a common procedure where the nose is reshaped purely for aesthetic reasons. In coding, this kind of procedure has a specific ICD-10 PCS code. In this case, it's 0NSB0ZZ. Recognizing these codes is key to accurate documentation and billing. And here's a helpful tip. When coding, always understand the objective of the procedure. Knowing whether you're modifying a structure for appearance or function helps you identify the correct root operation, alteration in this case. So to sum up, the main idea here is that alterations are about changing a body part's appearance without affecting how it works, and understanding this distinction is essential for correct coding and documentation. This photo, credited to an unknown author and licensed under CC BY-SA, helps illustrate a key concept in coding. On this slide, we're focusing on the definition of a specific type of procedure. It's essentially about altering the route of passage of contents within the body. Think of it as rerouting blood flow or other substances to improve health or bypass a problem area. An example of this procedure is CABG surgery, which stands for coronary artery bypass grafting. This is a common surgical example where a new route is created for blood to flow around blocked arteries. When coding such procedures, you'll encounter a sample ICD-10 PCS code, which is 21009W. This code helps ensure accurate documentation and billing. A very important coding tip here is to truly understand the objective of the procedure. By doing so, you can correctly identify the root operation, meaning the main goal of the procedure, and assign the right code. In this case, the root operation we're talking about is bypass, which fits perfectly with the idea of rerouting or creating a new passage for contents. So, in summary, always remember that understanding the purpose of the procedure is key to selecting the correct root operation and coding it properly within the overall classification system. On this slide, we're focusing on the concept of replacing a device without making an incision. This is an important aspect of coding because it often involves different procedures than those that require surgical cuts. For example, a common procedure is a urinary catheter change, where the device is simply replaced without cutting into the body. When coding these procedures, we use a specific ICD-10 PCS code, such as 2WPGX3Z for a urinary catheter change. It's essential to understand the objective of the procedure to select the correct root operation. In this case, the root operation is change, because we're replacing the device without incision. Remember, grasping the purpose of the procedure helps ensure accurate coding, which is crucial for proper documentation and billing. This slide ties into the overall theme of understanding different procedural approaches and selecting the right codes based on the specific actions performed. Now let's look at slide 5, which focuses on the concept of stopping post-procedural bleeding. The key idea here is that this is a specific type of procedure aimed at controlling bleeding after an operation or intervention. We often refer to this as the control of post-operative hemorrhage. For example, if a patient has bleeding after surgery, the procedure performed to stop that bleeding would fall under this category. When coding these procedures, you'll see the sample ICD-10 PCS code 0W3P0ZZ. This code helps us standardize how we record these interventions. A very important tip to keep in mind is that understanding the objective of the procedure is crucial. By recognizing the specific goal, to control bleeding, you can identify the correct root operation. In this case, control is the root operation, which indicates that the main purpose was to stop bleeding rather than remove tissue or repair a structure. So, in summary, when you're coding procedures for stopping post-procedural bleeding, always remember the main goal is to control the hemorrhage, and understanding that objective will guide you to select the correct code. This aligns perfectly with our overall theme of accurately capturing the intent and technique of each procedure for proper documentation and billing. Now, let's look at the key concept here, the definition. We're talking about making a new genital structure. This is a specific type of surgical procedure aimed at creating or reconstructing genital anatomy. An example of this is the creation of a neovagina, which is often performed in cases of gender affirmation surgery or congenital conditions. When coding for these procedures, you'll often see the ICD-10 PCS code 0W4M0ZZ. Remember, this code helps classify the specific intervention performed. A crucial tip to keep in mind is understanding the objective of the procedure. By doing so, you can identify the correct root operation, which is essential for accurate coding. In this case, the root operation is creation, because the procedure's goal is to create a new anatomical structure. So, when you're approaching these types of procedures, focus on the intent behind the surgery, what's being created or reconstructed, and that will guide you to the right code. Let's take a closer look at the definition of destruction. This refers to the physical eradication of a body part, meaning we're intentionally removing or destroying tissue or an organ. For example, a common procedure is cervical lesion cauterization, where abnormal tissue on the cervix is cauterized to eliminate it. When coding this, you would use the sample ICD-10 PCS code 0U5B7ZZ. A key tip here is to understand the objective of the procedure. Knowing whether the goal is to destroy tissue or remove a body part helps you identify the correct root operation. Remember, in this case, we're focusing on destruction, physically removing or destroying tissue rather than excising or cutting. So, grasping this concept is essential for accurate coding and for understanding how destruction fits into the overall picture of procedural classifications. In this slide, we're focusing on the concept of cutting off an extremity, which is classified under the procedure type called detachment. An example of this would be a bologna amputation, where part of the leg is surgically removed. The sample ICD-10 PCS code for this procedure is 0Y6J0Z0. A key point to remember is that understanding the objective of the procedure is crucial for coding correctly. You want to identify the root operation, which in this case is detachment, meaning the removal or separation of body parts. By grasping this, you'll be better equipped to select the appropriate codes and ensure accurate documentation. This ties into our overall theme of mastering procedural coding, where clarity on the purpose of each operation helps us assign the right codes efficiently and correctly. All right, let's dive into slide 9. Today, we're focusing on the concept of dilation, specifically as it relates to expanding the opening of a tubular body part. This is a common procedure in many interventional treatments. For example, coronary angioplasty is a well-known procedure where we expand the coronary arteries to improve blood flow. When coding these procedures, you'll encounter the ICD-10 PCS code 2703ZZ, which is used for coronary angioplasty. A key tip to remember here is that understanding the objective of the procedure is crucial. It helps you identify the correct root operation, which in this case is dilation, simply put, expanding or enlarging a tubular structure. So the main takeaway is that dilation procedures are all about widening a body passage, and recognizing this helps ensure accurate coding. This understanding ties into the overall theme of the presentation, accurate documentation and coding are essential for proper patient care and billing. Now, let's look at the key points on the slide. First, the definition of division is essentially cutting into a body part. It's a specific type of procedure where the goal is to separate or divide tissue. An example of this is the division of the optic nerve, which might be necessary in certain surgical interventions. For coding purposes, the sample ICD-10 PCS code is 8N0XZZ. This code helps us identify the exact procedure performed. A crucial tip to remember is that understanding the objective of the procedure is essential for selecting the correct root operation. In this case, the root operation is division, because the procedure involves cutting into a body part to separate it. Overall, when coding division procedures, focus on the intent to divide or separate tissue, and always connect that understanding back to the clinical context. This helps ensure accurate coding and proper documentation. All right, let's talk about drainage. Essentially, this is about taking out fluids or gases from the body. It's a common procedure used to remove excess fluid, pus, or air that can cause discomfort or complications. For example, a typical procedure might be an incision and drainage of an abscess, where we make an incision to allow the pus to escape and relieve pressure. When coding these procedures, you'll see the sample ICD-10 PCS code 0W9G0ZZ. Remember, understanding the objective of the procedure is crucial. It helps you identify the correct root operation, which in this case is drainage. So, the key takeaway here is that drainage procedures are all about removing unwanted fluids or gases, and your focus should be on grasping what the procedure aims to achieve to choose the right code. This concept ties into our overall theme of accurately capturing the intent behind medical procedures for proper coding. All right, let's take a closer look at slide 12. When we talk about excision, we're referring to the procedure where a portion of a body part is cut out. For example, a liver biopsy is a common procedure that involves removing a small sample of liver tissue for examination. The sample ICD-10 PCS code for this type of procedure is 0FB00ZX. It's important to understand that in coding, knowing the objective of the procedure helps us identify the correct root operation. In this case, excision is the key concept because we're removing tissue to diagnose or treat. Remember, the main takeaway here is that excision involves cutting out part of a body part, and understanding the purpose behind the procedure is crucial for accurate coding. This ties back to our overall theme of understanding surgical procedures and their coding nuances. All right, let's take a closer look at extirpation. The key point here is that it involves taking out solid matter from the body. This is a type of procedure where we're focused on removing specific tissue or objects, like clots or foreign bodies. For example, a thrombectomy is a common procedure that falls under this category. You might see an ICD-10 PCS code like 3CG0ZZ associated with it. One important tip to keep in mind is that understanding the objective of the procedure is crucial. Knowing what the goal is helps you identify the correct root operation, which in this case is extirpation. Overall, this ties into our broader theme of accurately coding procedures by understanding what is being done and why. When you see a procedure aimed at removing solid matter, think extirpation, and remember to connect the code to the specific goal of the operation. All right, on this slide, we're talking about the concept of pulling or stripping out a body part, which is technically called extraction. This is a key part of understanding how procedures are classified in coding. For example, a common procedure like a D and C of the endometrium involves removing tissue from the uterus, which falls under this category. The sample ICD-10 PCS code for that is 10D17ZZ. A really important coding tip here is to understand the objective of the procedure. By doing so, you can better identify the correct root operation, in this case, extraction. Remember, the goal is to focus on what the procedure is trying to achieve, whether it's removing or stripping out tissue or a body part, to select the appropriate code. So, keep in mind that understanding the purpose behind each procedure helps ensure accurate coding, which is essential for clear documentation and proper billing. Now, let's delve into the concept of fragmentation. Essentially, this refers to breaking solid matter into smaller pieces. A common example you might be familiar with is kidney stone lithotripsy, where the goal is to break up kidney stones into manageable fragments for easier removal or passage. When coding these procedures, you'll encounter ICD-10 PCS code, which specifically relates to this type of fragmentation. A key tip to remember is that understanding the objective of the procedure is crucial. By grasping what the provider aims to achieve, such as breaking a stone into smaller pieces, you can more accurately identify the correct root operation for coding. So, in summary, fragmentation is about breaking down solid matter, and recognizing the purpose behind the procedure helps ensure precise and effective coding. Now, let's take a closer look at the concept of fusion. Essentially, fusion is the process of joining bones together. It's a common surgical procedure used to stabilize parts of the spine or other bones that need to be fused for better support or to alleviate pain. An example of this procedure is spinal fusion, which is often performed to treat conditions like degenerative disc disease or spinal instability. When coding for these procedures, we use specific codes, such as the ICD-10 PCS code 0 SG00AJ, to accurately reflect what was done. A key tip to remember is that understanding the objective of the procedure is crucial. This helps us identify the correct root operation, which in this case is fusion. Recognizing the intent behind the procedure ensures precise coding and proper documentation, which is vital in the overall context of healthcare documentation and billing. All right, let's talk about this slide. When we refer to a procedure as putting in a non-biological device, we're talking about implanting devices that aren't made from biological material. A common example of this is a pacemaker insertion, which is often performed to help regulate a patient's heartbeat. The ICD-10 PCS code that corresponds to this procedure is 0JH604Z, and knowing the correct code is essential for accurate documentation and billing. Here's an important coding tip. Understanding the objective of the procedure helps us identify the correct root operation. In this case, the root operation is insertion, meaning we are placing a device into the body. So, when you're coding these procedures, always focus on what the procedure aims to achieve. Is it inserting, replacing, or removing a device? Recognizing this helps ensure you're selecting the most accurate and precise code. And that's a quick overview of implanting non-biological devices, an essential part of coding and understanding many medical procedures. Let's talk about the concept of visual or manual exploration. This is essentially when we examine the body directly, either visually or through touch, to gather information. An example of this is a diagnostic laparoscopy, which is a minimally invasive procedure where a small camera is inserted into the abdomen to look around. The ICD-10 PCS code for this procedure is 0WJG4ZZ. A key tip when coding these procedures is to really understand the objective of what's being done. This helps you identify the correct root operation, which is crucial for accurate coding. For example, when you're inspecting, you're primarily observing or examining the area to gather information without necessarily removing or repairing tissue. So, in summary, inspection involves a careful look, either visually or manually, to inform further diagnosis or treatment. This step is fundamental in the overall process of exploration and assessment in medical procedures. Now, let's look at the key concept of locating electrical impulses, which is fundamental in many cardiac procedures. This process is known as cardiac mapping, where we identify the specific electrical activity within the heart. For example, during cardiac mapping, a device tracks the electrical signals to pinpoint abnormal pathways or areas that may be causing arrhythmias. An example of the coding for this type of procedure is the ICD-10 PCS code 4A0234Z. One important tip to keep in mind is that understanding the objective of the procedure is crucial. This helps you determine the correct root operation to use when coding. Essentially, you want to focus on what the procedure is aiming to accomplish, whether it's locating, mapping, or otherwise analyzing electrical impulses, so you can select the most accurate code. This step is vital because it ensures precise documentation and proper reimbursement. So, in summary, cardiac mapping is about identifying electrical impulses, and knowing the procedure's goal helps us choose the right route operation for coding. This aligns with our overall theme of accurately capturing complex cardiac procedures through proper coding. Now, let's focus on the concept of occlusion. The definition here is straightforward. It involves completely closing and opening. This is a key point because it helps us understand what the procedure aims to achieve. For example, a common procedure is tubal ligation, which is performed to block the fallopian tubes and prevent pregnancy. When coding for this, we use the sample ICD-10 PCS code 0UL74ZZ. A crucial coding tip to remember is that you need to understand the objective of the procedure. Knowing the goal helps you identify the correct route operation, which in this case is occlusion. So, when you're reviewing procedures, always ask yourself, is the goal to completely close or block an opening? That's the core of understanding and coding occlusion procedures accurately. All right, let's talk about reattachment. Essentially, this refers to putting back a separated part of the body. For example, if someone experiences a finger amputation, the goal might be to reattach that finger. The procedure aims to restore the function and appearance of the body part by surgically reattaching it. In coding terms, the sample ICD-10 PCS code for this procedure is 0XMQ0ZZ. This helps us accurately document what was done for proper billing and record keeping. A key tip when coding reattachment procedures is to understand the objective of the procedure itself. By doing so, you can identify the correct route operation, which in this case is reattachment. So, in summary, reattachment is about restoring a separated body part, and understanding the purpose behind the procedure is crucial for correct coding. This ties into the overall theme of accurately capturing surgical procedures through proper coding practices. So, on this slide, we're focusing on the concept of release as a route operation in coding. Essentially, it means freeing a body part from some kind of constraint or restriction. For example, a common procedure is a carpal tunnel release, which relieves pressure on the median nerve in the wrist. When coding such procedures, you'll often see sample ICD-10 PCS codes like 1N50ZZ. Remember, understanding the objective of the procedure is crucial. It helps you identify the correct route operation, which in this case is release. So to sum up, always keep in mind that release involves freeing or separating a body part from constraints, and grasping the purpose behind the procedure is key to coding it accurately. This ties into our overall goal of precise and consistent coding practices. Today, we'll be focusing on the concept of taking out or removing a device, which is a common type of procedure you'll encounter. An example of this is the removal of a hip prosthesis, which is a procedure where a device that's been previously implanted is taken out. The specific code for this in the ICD-10 PCS system is 0SB90JZ. A key point to remember is that understanding the objective of the procedure is crucial. This helps you identify the correct route operation, which in this case is removal. When coding, always ask yourself, what is the purpose of the procedure? If the goal is to take out a device, then you're looking at a removal operation. So, in summary, when you see procedures involving device removal, focus on the objective. Are we removing a device or something else? This approach ensures accurate coding and aligns with the overall goal of precise documentation and billing. All right, let's talk about the concept of repair in medical coding. Essentially, this involves restoring a body part to its normal state or function. A common example of this is hernia repair, which many of you might be familiar with. When coding for these procedures, you'll encounter specific codes like the sample ICD-10 PCS code 0WQF0ZZ. One key tip I want to emphasize is the importance of understanding the objective of the procedure. By doing so, you can accurately identify the correct root operation, which in this case is repair. Remember, recognizing the purpose behind the procedure helps ensure precise coding and compliance with coding standards. So, whenever you see a repair procedure, think about restoring or fixing a body part, and that will guide you toward the right code. Now, let's look at the key concept of replacement. Essentially, it involves putting in substitute material to replace a part of the body. To illustrate this, a common example is a total hip replacement. In coding, you'll see this reflected in the ICD-10 PCS code 0SR90JZ, which specifies the details of the procedure. One important tip to keep in mind is that understanding the objective of the procedure is crucial for selecting the correct root operation. This helps ensure accurate coding and better communication about the procedure performed. So, when you see a replacement procedure, remember it's all about substituting a part with new material to restore function or relieve pain. All right, let's talk about repositioning. Essentially, this means moving a body part back to its normal location. It's a common step in many procedures to restore proper anatomy and function. For example, take fracture reduction, when a broken bone is realigned to heal correctly. The sample ICD-10 PCS code for this is 0QS604Z. A key tip when coding these procedures is to really understand the objective. What is the goal of the procedure? Recognizing that helps you identify the correct root operation, which in this case is repositioning. Remember, accurately capturing the intent behind the procedure ensures proper coding and billing. So, always focus on what the procedure aims to accomplish. Restoring normal position is at the heart of repositioning. Today, we're talking about the concept of resection, which involves cutting out an entire body part. An example of this procedure is a total nephrectomy, where the entire kidney is removed. When coding this type of procedure, a sample ICD-10 PCS code you might see is 0TT00ZZ. A key tip to remember is that understanding the objective of the procedure is essential for selecting the correct root operation. In this case, since we're removing a whole body part, resection is the appropriate term. Recognizing these details helps ensure accurate coding and proper documentation, which is crucial in our overall discussion of medical coding practices. Let's take a closer look at this concept of a partial closure of an opening. When we talk about this in the context of procedures, it essentially means that we're not completely sealing an opening, but rather partially closing it to achieve a specific purpose. An example of this is gastric banding, which is a common weight loss procedure. In coding, you'll see this represented by the sample ICD-10 PCS code 0DV64CZ. A key tip to remember here is to understand the objective behind the procedure. By doing so, you'll be better equipped to identify the correct root operation, which is crucial for accurate coding. So, whether you're reviewing procedures or assigning codes, always keep in mind the goal of the intervention. It helps to clarify the coding process and ensures precision. This ties back to our overall theme of understanding the nuances in procedural coding to improve accuracy and consistency. Let's take a closer look at what revision means in the context of coding. Essentially, it's about correcting a malfunctioning device. When a device isn't working properly, a revision procedure is performed to fix or improve it. For example, in the case of a knee prosthesis, a revision might involve replacing or adjusting components to restore proper function. The sample ICD-10 PCS code for this type of procedure is 0SWC0JZ. This code helps us accurately document the specific intervention performed. A key coding tip here is to understand the objective of the procedure. By doing so, you can correctly identify the root operation, which in this case is revision. Remember, the goal of revision is to correct or improve a device that has failed or isn't functioning as intended. Recognizing this helps ensure accurate coding and better reflects the clinical work involved. Now let's look at the concept of a reinforcing body part. Essentially, this refers to a part of the body that is used to strengthen or support an area that's been weakened or damaged. For example, in hernia repair procedures, a common approach is to reinforce the affected area with a mesh. This mesh acts as a supportive structure to help restore strength and stability. When coding such procedures, a typical example is the ICD-10 PCS code 0WF0JZ, which specifically relates to hernia repair with mesh reinforcement. One key tip to keep in mind is understanding the objective of the procedure. This helps you identify the correct root operation in coding. In this case, the goal is to reinforce or support a body part, which guides you to the right code. Remember, grasping these core concepts about reinforcement and the purpose behind procedures is essential to accurate coding and ultimately to reflecting the true complexity of the work performed. This ties into our broader theme of precise and meaningful coding practices. Let's take a closer look at the concept of transfer in medical coding. Essentially, it involves moving a body part from one location to another. This is a common procedure, especially when restoring function or improving mobility. One example of this is a tendon transfer, where a tendon is rerouted to assist with movement. For coding purposes, the sample ICD-10 PCS code for this type of procedure is 0LX80ZZ. A key tip to remember is that understanding the objective of the procedure is crucial. By knowing what the surgeon aims to achieve, you can accurately identify the correct root operation. So, when you're coding a transfer, think about the goal of the procedure. Are they relocating tissue, or perhaps rerouting a tendon? This understanding will guide you to the right code and ensure precise documentation. Overall, grasping the concept of transfer helps us better interpret the procedure's intent, which is essential for accurate coding and effective communication within the healthcare setting. Today, we're looking at the concept of transplantation, which involves putting a body part from a donor into a recipient. This is a critical procedure when a patient's own organ isn't functioning properly, and a transplant can be life-saving. For example, a kidney transplant is a common type of transplantation, where a healthy kidney from a donor is implanted into a patient with kidney failure. In coding, the sample ICD-10 PCS code for this procedure is 0TY00Z0. It's important to understand the objective of the procedure to identify the correct root operation, which in this case is transplantation. Remember, grasping the purpose of the procedure helps ensure accurate coding. So, in summary, transplantation is about transferring a body part from a donor to a recipient, and understanding the goal of the procedure is key to selecting the right code. Now, let's look at some important distinctions between excision and resection. Excision refers to removing a portion of a body part, which is useful when only a part needs to be taken out. Resection, on the other hand, involves removing the entire body part, often when the whole organ or structure needs to be taken out due to disease or damage. Moving on, extraction means pulling out a body part, such as extracting a tooth or a foreign object. Extirpation is slightly different. It involves removing solid matter from the body, like a tumor or a clot. When it comes to removal, we're talking about taking out a device, like removing a pacemaker. Change, however, means replacing a device without making an incision. Think of swapping out an implant without surgery. Repair is about fixing or mending tissues or structures, restoring normal function. Reposition involves moving a body part back to its proper place, which is often necessary after dislocation or injury. All these terms highlight the key differences in procedures, whether you're removing, repairing, or repositioning. Understanding these distinctions helps us accurately code and communicate about various surgical interventions, fitting into the overall theme of precise medical documentation. Let's start with always identifying the objective of the procedure. This step is crucial because it guides our entire coding process and helps ensure accuracy. Next, carefully reading the operative report is essential. It provides the detailed information we need to make correct coding choices. We also need to distinguish between removing a body part and removing a device. These are different procedures with different coding requirements. When in doubt, consulting Coding Clinic and the PCS guidelines can offer valuable clarification and authoritative guidance. It's also vital to thoroughly understand the root operation definitions, especially when preparing for exams or performing actual coding. A solid grasp of these definitions ensures we code correctly and consistently. Lastly, keep in mind the key coding guidelines. They serve as our foundation for accurate and compliant coding. By integrating these points, we can approach coding methodically and confidently, supporting the overall accuracy and integrity of our work.